Good evening and welcome. My name is Stan Lyles and I'm the Vice President of SEIU-UHW, and welcome to our meeting this evening. Today, we want to have a conversation with you, and it's about COVID-19, the vaccines, and the vaccinations. You know, we have heard a lot of things, a lot of rumors, but hopefully tonight we'll have a conversation where some of the myths and misconceptions will be put aside, because our healthcare workers are under attack. So many of them are dying from COVID-19. As you look around the country, we see that thousands of healthcare workers have passed away fighting on the front line of COVID-19. Even as of today, at UHW, we have lost 30 of our members, and it's sad. So what we want to do tonight is have a really good, frank conversation about the vaccines and vaccinations. So tonight we have 4 guest speakers. We have 2 from our Kaiser division who will be talking with us, members of UHW. And also we're very fortunate to have 2 physicians from Kaiser Permanente that will be talking with us this evening. So I hope you sit back, you relax, and have a really good interchange of ideas of how we can combat this COVID-19. You know, things are really getting out of control and nothing is getting better. And for me, on a personal note, I've even had, people in my family. I had a niece that had COVID-19 that's doing much better now. I had an 80-year-old aunt in Florida who's recuperating from COVID-19. And on Christmas Day, our oldest daughter came down with COVID-19. So this is the real, and there's something, and we must do something about this. So, have an open mind, and let's, put it all out on the table, and let's have a conversation this evening. So I'm going to pass it over to Savonnda.
Good evening. Thank you, Stan. So my name is Savonnda Blaylock, and I work at the outpatient pharmacy in Tracy, California. And I'm now going to pass it over to Eric.
All right. Good evening, everyone. My name is Eric Vuong. I work as an inpatient pharmacy lead technician at Santa Clara Kaiser.
Hi, good evening. My name is Dr. Little-Richardson. I'm an OBGYN at Kaiser San Jose, and I'm really happy to join today.
Hello, my name is Dr. Daisy Dodd. I do pediatrics and infectious diseases, Southern California in Anaheim.
So this evening, we're going to have a candid discussion regarding COVID, and I just want to welcome everyone to the meeting and to the call. And I just want to say, our union, SEIU-UHW's core mission in this pandemic has been to protect the healthcare workers and the livelihood, so we can continue to work on the front lines and serve our members. Right now, the widespread vaccination of the population, including frontline healthcare workers, is key to being able to end this pandemic. Since we currently have the priority access over anyone in getting the vaccines, we want to ensure that people can make informed decisions about getting vaccinated. before the vaccination goes to other tiers. So right now, I just want to set one ground rule in particular, and I realize that some people, they're going to have strong feelings, and they do have strong feelings about vaccines, and that's fine. Let's make this a productive dialogue, and let's just keep it respectful. So I'm going to start it off with a question, and the question, I'm just going to put it out there and asking everyone if we can get any people to give us messages on what they feel about it. First, I'm going to ask, have you gotten vaccinated? Then I'm going to ask you why or why not. And I'm going to start with us. I'm going to start, Eric. How about you? Have you been vaccinated?
Yes, thank you, Savannah, by the way. Yes, I have.
And can you tell me about that decision? What that made you get vaccinated?
Sure. I think the best way for me to share with everybody the decision why I chose to get vaccinated is to tell you and to tell everybody else a personal story. Recently, a very close cousin of mine, she's a pharmacist, and her husband, who is an anesthesiologist, came down with COVID. They suspect that he got COVID from his workplace due to his lack of wearing proper PPE, which is personal protective equipment. As a result, he unknowingly brought COVID home to his families. They were and still are living with both their parents. So the whole family in the home came down with COVID. The situation there was quite extreme. They came down with extreme cases of COVID, with the doctor's mom actually getting admitted into the ICU. She even got intubated and then coded twice. Fortunately, she pulled through. And so there was, as you can imagine, there's a lot of intense moment at that time for the family as well as for us hearing the news. So for those reasons, especially for myself as a healthcare worker and as an inpatient pharmacy technician working at a hospital, delivering medication and interacting with various staff of the hospital, from the ED to the ICUs to the ORs, even attending with the pharmacists, sometimes cold blues, where the patients themselves are COVID positive. I consider it to be essential and vital that I get vaccinated. Doing so protects me, as well as protecting, the patients that we serve, protecting fellow coworkers, and of course, protecting my family. I have a wife and 2 young sons, and of course, protecting the larger community on the whole. So in that sense, I encourage everybody to get vaccinated. My own experience with the vaccination, which I went through 2 shots. I had the Pfizer vaccine. Luckily, I did not suffer any major or even minor side effects, with a slight, maybe sore point at the point of injection. But beyond that, that was basically the reason that prompted me to get vaccinated.
Thank you, Eric. Thank you so much. So I'm glad you were able to share your story. And I just want to share something. And I get anxiety even thinking about it, speaking on it. In the beginning of December, I was totally against being vaccinated. I have not been vaccinated as of yet. I will be, but I was totally against it just because I did not want to be per se just part of a test experiment. And so I was totally against it, and I was not, and I was speaking against to my family about not getting a vaccine up until the beginning of December. I was exposed. I still don't know exactly how. It doesn't even matter at this point. But I was exposed, and my daughter was exposed at the. My youngest daughter was exposed at the time first, and then I was exposed, and we had COVID. And trying to take care of myself, and I couldn't take care of my child. And my husband has a pre-existing condition, so he had to quarantine elsewhere. He tested negative, and he had to quarantine outside of the home. And it was that fifth day when I felt like I was just losing all strength and energy and hope. And I was in one room, and my daughter was in another room, and we both were so sick that I just knew I cannot go through this. I was at home thinking about what would happen to me or my child at home. We had no one. Another daughter was attempting to take care of us, and then she was infected. So it was three of us in the home infected. Thankful for my friends and family that dropped off things on my porch, but I would never want that. There's people in the hospitals right now that are fighting for their lives. I felt like I was fighting for my life, but there are people that are dying from this. And the only way we're going to really get a handle on it if we get vaccinated. And my story is for me, but I want everybody to make an informed decision. And don't feel pressured, but please think about you and your family. And I wouldn't want anyone to come down with this. I thought I was strong. I take vitamins. I thought I was healthy. I did not think COVID would touch my family. I thought I was doing everything the right way, but obviously I wasn't. Something went wrong. And I don't wish it on anybody. And I really, after I went through it myself and my child, I could not be there for my child. I did come to the conclusion that I would be getting vaccinated, and I am going to get vaccinated. I just hit a month with after symptoms that I was having, but I still have no sense of smell, but I can taste a little. So I'm feeling better, but I think we do all need to be informed about COVID. So I'm just gonna move it on and with questions. And I was reading a question. Someone says, "Do anyone know the side effects of the vaccine?" And we have professionals here that can answer that. So, Dr. Dodd, thank you.
First of all, let me say thank you so much for sharing your story and sharing your feelings. Because of you, I got vaccinated. Side effects of the vaccine, the ones that have been described, can be as small and perhaps some pain at the site of the injection, some redness, or they can be what we call systemic, meaning that you can have some headache, some body ache, some tiredness. I got both vaccines. The first vaccine, it was I felt nothing. I didn't even feel the injection when they gave it to me. Nevertheless, the second one, which we usually say you might have some side effects, I did have some chills, some low-grade temperature, some body ache and headache. Lasted approximately 12, 14 hours. And after that, I was perfectly fine. I'm very glad that I got my vaccine. I can't say how elated I am. I even took a picture when they were giving me the shot because I'm doing it not only for me, I'm doing it for my family, my kids. I have elderly parents. I'm doing it for my patients, for all of those people around me, because unfortunately, I have seen people die. And that shouldn't be the case. Now we're able to do something about it. And I know that there might be some fear, but the vaccines are extremely safe. So let's go at it.
Thank you, Dr. Dodd. So another question that had come up. I'm reading questions in. Is there anyone anyone with health conditions that should not have the vaccine?
Hi, Dr. Little. So I'm happy to field that question. And I want to just reiterate, thank you, Savonnda. Thank you, Dr. Dodd, for sharing your stories because they're very personal and you could see the emotion and how this has affected us. Again, thank you. I too also got the vaccine. And really, number one, in terms of health conditions, is checking in with your primary care doctor because they really have the most extensive list and they know you the best to determine whether you are a candidate. At this time, we're saying, the research in terms of, for example, pregnant women, those who are planning to get pregnant, they weren't specifically tested in the Pfizer and Moderna studies, but the American College of Obstetrics is saying those are patients who should have access to the vaccine. And then same for immunocompromised patients, they're saying that they are also eligible for the vaccine, but the final decision really is between you and your doctor thinking about what specific medical condition you have.
Thank you, Dr. Little-Richardson. So I know that there was another question, and I just want to touch on this question because I've heard it before. So I know there have been a lot of African Americans, I know in my family also, that are fearful of getting the vaccine because of history of what has happened in the past. And I just want to know, is there anything you can say to kind of about the vaccine, about how long because what a lot of people are saying is it was made quickly. It was produced quickly. So can I hear, like, do you guys have any insight on how they were able to get it so quickly versus other vaccines that have taken years to develop?
Okay. I'll take this.
Thank you.
The vaccine, the root of it, the technique has been around for quite some time. This is not anything that is new. We are actually using it for other interventions, for oncological, for medications and things like that. So this is not anything that just came up a few months ago. This is almost, think of it as a piece of a puzzle, and this is a whole puzzle. The puzzle has been put together way before. We were just missing the one piece. And the one piece is what we call the messenger RNA. And we had to get that from China, from the officials, to be able to put it to complete the puzzle being the vaccine itself. So no, this is not anything that is new.
Thank you, Dr. Dodd.
And I would also like to add as well, I recognize and validate those who have those trepidation, fear in terms of thinking about the history that the United States has had in regards to patients of color, people of color. We have faced abuses with the medical community in the past. And so I can understand why people are hesitant because that is a real history. But I am, really confident when I personally have reviewed the literature in regards to the Pfizer vaccine, the Moderna vaccine, and this mRNA vaccine. I'm really confident. And they included African Americans and Hispanics in the study. They're part of the patient population and the trials. And so we know that these vaccines work for us as well.
So I have a question. So
Okay.
someone,
Oh.
if there isn't a live virus in the vaccine, why are there side effects similar to those of the COVID virus? Good question.
Typically, we know that when we put, whether it might be a particle, and there has been a series of the way that we prepare vaccines. Typically, we can have what we call an activated virus. We can have a piece of it, or we can have what we call an attenuated virus. With the case of the COVID vaccine, with both Pfizer and Moderna, they're using a small piece of the virus. Think of it as a strand of my hair, to be able to teach our body how to produce a protein that then can create what we call antibodies. And once and if we're exposed to the actual germ, we are able to go ahead and respond and take care of the infection. Why do we have side effects? Because this is something that our body doesn't recognize. We haven't had it before. I almost said, when I had my reaction with my second shot, I said, aha, the vaccine is working, because my body's kind of saying, hey, this is something new I have to act upon. I can even think remotely. I have not had COVID, but I don't think that what I felt was anything close to what my patients had felt. For one thing, I recuperated with no medications at all within a matter of a few hours. So the response that I had was minimum. Some people haven't even had any response whatsoever. They didn't feel anything. I just happened to be one of a few that did feel that. So basically what you're feeling is your body's response, we call the immune response, to something that it hasn't seen before, and it's all good.
Thank you, doctor.
You're welcome.
Another question is, what would you recommend for those who have bad allergies?
Well, in terms of allergies, there's no specific contraindication, meaning unless you have an allergy specific to the compounds in the vaccine, that even if you have seasonal allergies or allergies to penicillin, you are still eligible to receive the COVID vaccine. A specific reaction, it's best to follow up with your primary care doctor to see if that is a reason you wouldn't, but the majority of allergies, people are still eligible to get the vaccine.
Okay, great, thank you. And okay, Becky, there's a lot of mixed information out there about if you tested positive for COVID, that you cannot get the vaccine. Is that true?
That is not true. You actually are recommended to go ahead and get vaccinated. What we don't want is for you to get the vaccine when you're barely recuperated. And that would be true of most of the vaccines. If you had a cold, if you had a bad flu, I wouldn't be recommended to you a week later to go ahead and get the flu shot. Because your body might still be recuperated and you might not have an optimum response to the vaccine. We usually recommend, and at least to wait a month or two if you had a documented acute infection to COVID, to wait, and then you can get vaccinated. We feel that perhaps the immune response that you can get to the vaccine is longer than what you might get with the natural disease. The natural disease might get you perhaps about 2 or 3 months of protection from what we know now. With the vaccine, we're hoping that you can get at least a year protection. Now, remember, all of this is new. So obviously, we're learning as we're going along. But no, yes, you are definitely recommended to get vaccinated.
Okay, another question. Why are people testing positive after the vaccine?
That's a great question. I think it goes to the fact that we aren't doing universal testing right now. There are people who are receiving the vaccine who may already have been exposed to COVID, coronavirus, before getting the vaccine. And so the vaccine does not make you test positive unless you were, exposed. And so it's hard. So if you did get the vaccine after you had unfortunately already been exposed, it would be kind of confusing. You cannot get COVID vaccine.
Okay, so is this vaccine to prevent COVID-19 or to lessen the symptoms of COVID-19?
Excellent, excellent question. Because we talk about the fact that the vaccine will prevent moderate to severe disease versus infection. Infection means I picked up the germs. I might be able to carry it in my nose, might be able to give it to somebody else when I have no symptoms. I'm totally asymptomatic. The vaccine might or might not help with that. We don't know just yet. Now, it does prevent from you getting the disease. In other words, getting the lung involvement, getting the inflammatory cascade, getting people, preventing death.
Thank you. And how long does the vaccine last?
I will go ahead and speculate. We don't know yet. We're thinking that perhaps might be if this is behaving like most viruses do, most respiratory viruses. Influenza is a very good example. We actually see that we have to immunize people pretty much every year because the virus, and we're seeing it already, the virus has a tendency to change its generic makeup. The way I told my patients, the virus is changes its underwear. So we have to be re-immunized to be able to re-challenge and have good immunity.
Thank you. Good question. If I'm a diabetic, what are concerns should I be aware about if I decided to take the vaccine?
Great question. I think it goes back to thinking about the pre-existing conditions and if you have any medical conditions that make you ineligible or not a good candidate. So diabetes alone does not mean that you're not a candidate for the COVID vaccine. And so, number one, you think about what is your risk of getting COVID, the coronavirus, and how would that affect you? And if you were to get sick, is that risk greater than the theoretical risk from the vaccine? And I would say yes, because it is a pre-existing condition that many do consider kind of immunocompromising, meaning that you are at increased risk of more severe disease, so increased risk of more severe coronavirus disease. So I would think that you're an excellent candidate. But again, if you're ever concerned, to speak with your primary care doctor about your specific medical case. But I think you're an excellent candidate for the COVID vaccine.
Thank you. And another question, there's just not enough research for me. This vaccine was made too quick, too many unknown answers. With someone.
The vaccine, as I mentioned before, there has been a lot of research, and obviously there's going to be much more coming. It is true of any vaccines that we have had all along, even from the beginning of mankind. The platform of the vaccine has been studied. I mean, it goes back beyond probably the year 2000, when we had what we call SARS-CoV-1. And they started coming up with this setup, with this. It is something that is being studied all along. It's just that by the grace of God, things got better and the vaccine didn't progress. As I said, the structure of the mechanism of how the vaccine has been prepared is old. It is only this little piece that we put in that is being taken into account to be able to allow us to respond. You can imagine, like anybody else, I'm concerned of getting something in my body. And so I have done a lot of study. I have done a lot of research because, yes, I don't want to be the first one. No, I don't want to be a guinea pig either. I don't want my family, my friends, my patients. So I have done a lot of studies. And through everything that it has come out, it has only given me but comfort in being able to realize that these are safe vaccines. Furthermore, if we extrapolate years back, many of the vaccinations, if you're going to have a major side effect, it will usually occur during the first 60 days of the vaccine being generated. And these vaccinations have not any major problems. And so I feel very comfortable. Not only have gotten it myself, but I can hardly wait for my parents, my husband, and hopefully eventually my kids will get it, because this is a devastating disease.
But at the same time, I would just like that, I think if I'm saying your name correct, I may not be, Maliaka or Malika, I recognize your fear, and, I validate that you are entitled to your opinion. Every person is entitled to their final conclusion. We just want to make sure that you have all the most up-to-date and true information. Unfortunately, there's a lot of things that are not good resources. And so we want to be able to give a platform that you can make a final decision, which is your decision, but that you just know what's true and what's not. So I understand.
Thank you. Thank you. And so someone had asked, another question was, will vitamin A and vitamin C and vitamin D, do they protect or prevent COVID-19? Yes. Does vitamin D and C help with fighting COVID-19?
Well, we do know that vitamin D and vitamin C do act in the immune system, so that a lot of the times when patients are asking you, is there something that I can do to prevent it? Yes, you can take some vitamin D, you can take some vitamin C, and even melatonin. Those are things that naturally our body will produce, but when taken in amounts a little bit more generous, can be protective. And as a matter of fact, it's part of the treatment regime that we provide to patients with COVID. But obviously, before you go about taking any of these vitamins on a higher recommended dosage, my advice will be to check with your physician directly. What should you be taking? How much you should be taking? Because there are certain conditions. If you have kidney problems, for example, and you're taking excessive amount of vitamin C or D, that might be dangerous to your health. So it's very important to always check with your provider.
Thank you, doctor. And so I'm gonna answer this question. Should someone trying to conceive take the vaccine?
Yes. If you are not currently pregnant, there's really no reason not to get the vaccine. And even if you are pregnant, it's still a good idea to get the vaccine. Pregnant women have an increased risk of having more severe disease. So again, the COVID vaccine can help you protect against the severity of coronavirus. If you are trying to get pregnant, it's an excellent time to get it, because you don't even have that little fear of potential future effect of having, a pregnancy. Because the reality is that pregnant women were not included in the study directly, though each study did have people who were pregnant who participated and maybe did not know, and they didn't have side effects. But definitely trying to get pregnant is a good time to get the vaccine. But if you're still concerned, again, talk to your OB, and they can give you more details as well.
Thank you. Thank you. So I just want to put out that on our website, SEIU-UHW, we do have informational resources regarding the vaccine and information. We're going to take a couple of more questions. Definitely, you guys have some good questions. I like this one. Can anyone donate plasma, and what does plasma do to a patient with COVID-19?
Yes, if you have had the infection, actually the blood bank will contact you if you have had COVID-19 infection. Plasma basically is a part of our blood that contains what we call antibodies. It helps you fight infection. And so when we have an individual that have antibody-rich blood, and that's given to somebody who is moderate to severe disease, it seems to help. So yes, you will be contacted, and it's up to you as an individual whether you want to donate But they automatically they do that. Yes.
Okay, and I have another question, and it's, should we do the blood test for COVID to check immunity after the vaccine?
That's a very good question. No, it has not been recommended. They did it on the studies. They have studied and they keep following patients that have been the experimental groups. They have been hundreds of thousands of patients that have received the vaccine. And that's how we come to that number of protection, because we know that the way that the vaccines work, not only do they stimulate the production of antibodies, but they stimulate something called T cells, which are memories or things that remember, oh yes, I saw that little particle of germ. Let me react. Let me go ahead and kill it. So it's not just about antibodies, but it's also about T cell function. No, at the present time, we're not recommending you were vaccinated. Hey, doc, I want to make sure whether I reacted or not. Should I go ahead and get a serology test? We're not recommending that to be done at the present time.
Okay, thank you, thank you. And I have one. I'm due for, okay, zero's wrong. There's a lot of fear that they put in a microbot tracking device in the vaccine. It is causing a lot of fear in the religious community.
Yeah, I have seen, those sort of things on Facebook and on different social media sites. It isn't true. There haven't been any studies showing that. And again, there's no kind of, I keep thinking about the Matrix. There's nothing that's going in your body that's tracking you. But, when you have people who do have those beliefs, beliefs are very deep founded, and it's hard to kind of change those kind of that misinformation. And so in those situations, all we can do is kind of present the truth, kind of try to reassure them that our goal is for everyone to be back in society with their loved ones again, going on trips, living the healthy lives they were used to before COVID-19 struck. And the vaccine is really pivotal to helping us get back to that lifestyle that we all miss and love. And so thinking about it in those positive terms may help increase, members of those communities and increasing their vaccine numbers. But it's not something that a belief we can break per se. It's a hard situation.
Thank you. Okay, another question. Do you know if and when the vaccine will be available to our children?
The original studies that we have had to date have been from 16 and 18 years up. Both Moderna and Pfizer have started. They dropped the age of investigation down to 12 years of age. And one of the reasons why the studies didn't include kids to begin with is because, thankfully, kids don't do as bad as adults do with the virus. We do have a complication. It's called MIS-C, multiple inflammatory syndrome in children, but it's very rare. And so it was felt that it was optimum to protect the high-risk individuals, in this case being senior citizens and or adults with underlying medical conditions. But yes, they are dropping the age of investigation to 12. Hopefully, once we know how their immune body responds, we'll drop it to 6 and so on and so forth. My personal opinion is that it probably might take close to a year before we're able to get it down to the age of our children so that they all can get vaccinated. But hopefully we'll get it before the school age coming this year. So we have to wait and see.
Thank you, thank you. Okay, how effective is the vaccine if one does not get the second shot within the 21 days?
So, we do say that you need both shots in order to get that goal 95% efficacy that we keep talking about in terms of the vaccine. However, even if you miss the 21 days or 28 days, if it's the Moderna vaccine, you're still eligible to get the second shot. So whenever you're able, you should get the second shot, even if you're outside of the 21 days. And that's just to help you get to that 95% efficacy.
It is important to say that after your first vaccine, you might have approximately 60 to 70% protection, but that's not as significant. We do want that second vaccine, and you do have a period that you can get it. Obviously, the sooner you get your second vaccine, the sooner you're going to have the full protection. You can always get it, even a month after if need to be.
Oh, good to know. So do we know if the vaccine is effective against the new strains coming out of South Africa and Great Britain?
Yes, the vaccine is effective with this new strain that is coming out. As a matter of fact, unfortunately, we have had a few cases here in the United States with the new strains. And as mentioned before, viruses do that, and they do it quite often. This is not a one-time, one thing, one virus. The stimulus that you get is actually kind of a polyclonal. So it will be able to identify this, as long as it's just a small variation in the genome or on the memory that we're getting, the protein that we're producing, it will be able to provide adequate protection.
Thank you. So why do they ask about the allergy reaction to medication or food prior to administering the vaccine?
It's really to help identify if you're a patient that could potentially have a higher risk of having a more severe reaction. Really the food is not as important as an anaphylactic or very strong reaction to another vaccine. Even though the components of this vaccine are unique, most times after we give you the first shot and after the second shot as well, we do a period of observation that's usually about 15 minutes. And so if you're a person that has a history of having anaphylaxis, we actually will watch you more closely. Sometimes we also will add a blood pressure cuff so we can monitor if there's changes in your heart rate or blood pressure, so we can be able to give you assistance very quickly if needed. And I think that's why we're asking that question.
Thank you. Can you become infected with COVID virus a second time or can infect others?
It's very interesting because we know that there have been some cases reported, particularly from China, individuals that have been proven to be infected for a second time with the different strain of the virus. We have not seen that in our practice as such. So I will dare say that at this point, no. One of the things that we do notice, however, after you have had the virus, after you have had the infection, you can actually shed, or you can, the way that I tell my patients is, think about having had a bad cold. You're better from your cold, but you still have some boogers. You still have some secretions. And so in those secretions, if we were to do a test, theoretically, as sensitive as you might be able to still get the infection from me. That's why we usually say that quarantine period, that 14-day, because although you might be getting better, you still might have potentially some viruses that might get another individual infected.
Thank you. So, is it known as to why COVID attacks major organs in the body, doing irreversible damage? My sister-in-law's side effect of COVID is an enlarged heart. Will that eventually go away?
I'm very sorry to hear about your sister-in-law, and our thoughts are definitely with her, and I hope that she has a speedy recovery. And I think Dr. Dodds might also be able to add to this. I think we think about COVID as really causing an inflammatory response, and that can affect multi-systems. And even though we think of, the typical cold flu as affecting the lungs, the heart is very close to that, intimate with that. And if you have an enlargement, usually that's kind of an inflammatory process around the heart. And sometimes those processes can take a long time to heal. And I think that's something that's unique about COVID, why it's so dangerous, because we're seeing individuals that are having long-term effects. I think at this time, unfortunately, we don't have a timeline for when recovery would be. Every person is different. And there are people that are having lingering effects, 6 months afterward or even longer. I don't know if you have anything else to add to that, Dr. Dodd.
Yeah, it's very interesting, Dr. Richardson. And yes, my heart goes out to her sister, and I pray for a prompt recovery. But we do know that the effect that we have, the multi-inflammatory effect, is more the body's response to the virus in and of itself. And there's different scenarios in terms of how your body is doing, how strong you are. And we have realized that obviously predisposing conditions can make you have a worse outcome than if you were totally healthy. But having had 17, 18-year-old healthy young adults who have been very sick, we know that this virus doesn't really forgive very easily. So that the best that we can do, as we were talking about it at this point, is obviously get vaccinated and try in the meantime to observe all the precautions that we have done so far, covering with a mask and distancing, washing hands.
Thank you. So will this be an annual shot from now on?
As I mentioned, we don't know at this point. I kind of extrapolated and I borrow from the influenza vaccine, that we know that we have to receive influenza vaccine every year. One of the reasons is the fact that we said the virus does make generic shifts or a change. It's almost like changing the color of your hair. One day you can be a red hair, another day you can be a blonde hair. And so, because the virus that's changed is generic makeup, we feel that probably we're going to have to get re-immunized every year, and the vaccine needs to be upgraded depending on what kind of virus is circulating in the community.
Thank you. So what are the chances of us spreading the virus when we get the second vaccine?
We would hope almost close to zero, because the hope is that if you get the vaccine, you didn't get the virus. So again, when you receive the virus, you are not receiving the live vaccine, so you are not becoming infected with COVID disease. And so, even though after receiving both vaccines, we think that it's up to 95% effective, there's still that 5% risk that you could get COVID. And that would be the instance in which you would spread it to another. But getting the virus hopefully makes your chance of getting it to someone else basically zero.
Okay, great. Thank you. So has there been human testing before now? And if so, were there any major side effects?
We have had a number, and it have been tens of thousands of individuals that have been immunized. And the way that the studies are done, there's different stages. You start with stage 1, getting healthy individuals that are selected to get the vaccine. And then we move to stage 2, in which you're picking a few of the people that might have some of the underlying medical problems or the target group. And finally, you move to a bigger population. And so there have been hundreds of thousands of people that have received the vaccine. Dr. Richardson mentioned the fact that it has been given to different populations, Hispanics and Blacks and different countries, Brazil, Africa, Europe. So it has been administered to different populations all around. And I know with Pfizer, they did stop the testing when one gentleman developed a condition called transverse myelitis. It can be due to a virus. And a lot of the times when you're doing a study like this, you have to say that this person get this problem because of the vaccine, or were they going to get it anyway? And transverse myelitis is something that we know that you can see with a multitude of viruses in the community. It hasn't been reported after that. So this is one in hundreds of thousands of individuals. And what are the chances that he might have gotten this regardless of having had the COVID vaccine? I will dare say he probably would have gotten much more than in relation to the vaccine.
Thank you. Thank you. So this is a lot. This question is, what do we know about the Sputnik V, the CoronaVac, and the AstraZeneca vaccines that are now being utilized by other countries? Are they as effective as the Pfizer and the Moderna vaccine?
I do have information about the AstraZeneca because they have started putting the information out. And obviously, as a doctor, we want reliable sources. We don't want whatever Facebook or other media might be putting out there. We want actual reports. And Oxford AstraZeneca has started with some reports. They did have studies in Brazil. They also had studies in England. And the outcome so far has been very good.
Thank you. So one more question after this question. Does being on Imuran and Plaquenil decrease the effectiveness of the vaccine?
So, those are what we call in the class of immunosuppressant medications, which may be used in certain like rheumatologic or lupus, specific medical conditions. And I think in that sense, those medications themselves are not necessarily associated with decreasing the effectiveness, but you do want to think about the underlying medical conditions that those vaccines are treating. And though there's no specific medical conditions that we say make you ineligible to get the vaccine, it's still important for you to check with your primary doctor to see, thinking about your whole personal medical picture, if you're a good candidate for the vaccine at this time, whether to delay. So, those medicines make you think, okay, what are we treating? And then thinking about what we're treating, all right, is this a good time for the vaccine or not? So I think check with your primary care doctor, but those medicines specifically aren't themselves a reason that you can't get the vaccine.
Okay, thank you. And last question is, when will we get totally control of this virus?
When we all get immunized.
Exactly what I was going to say.
Yes. So I'm going to turn it over to you guys for final comments by each participant. And thank you guys for participating. So Dr. Little-Richardson, do you have any last comments you would like to leave us with?
Well, thank you, Savonnda, for leading us and directing us this evening. I really hope that everyone got their questions answered, that they feel like they have a good resource to find information that's true about the COVID vaccine. And then again, I just want to say that I understand why those of color might be hesitant to get the vaccine based on the history of medicine and how our communities have been treated. But I think that, I personally took the vaccine because I read the research. I feel confident about its safety, efficacy. And I think that thinking about the fact that those of us, people of color, we are more infected, we are more hospitalized, and we die at greater rates. And I think the benefit from the vaccine is so great that it's worth it for everyone to get it.
Thank you. Dr. Dodd?
Well, I have to say thank you so much for giving me the opportunity to participate. It has been my honor to share the platform with Dr. Little-Richardson and with Savonnda and Stan. I also have to say, it's just like you, Savonnda, I had my reservations in the very beginning. What is this vaccine all about? After I did my homework, I went ahead and I felt very comfortable getting the vaccine. So comfortable that I can hardly wait to give it to my parents, to give it to my children. And they're very dear to my heart. I love my patients, but I also love my family. And so I can hardly wait to give it to them. No, I can't explain about what is have gone in the community before, but I know what is going on right now. And whether we're talking about Latinos, which I represent, whether we're representing African Americans, we are number one in the death poll, and we have to change it. We have underlying medical problems that, whether it might be because of resources, we're not going to get into that, but we are number one when it comes to the death poll. We have to decrease that. We have made a sacrifice. We're putting masks. We have changed our celebrations, how we celebrate Christmas, how we celebrate Thanksgiving. So let's go ahead, and for the sake of those that you love, please get vaccinated. Take care of yourself so that you can take care of others.
Thank you. Thank you. So Eric, he lost connection. He's at work right now. So I'm just going to say this was very informative, and I really appreciate all the insight and the knowledge from everyone. And now for Stan.
You know, I just want to say, wow. I mean, this was a great wealth of knowledge that you all shared with us today, and we really, really, really appreciate it. I'm sure this will be one of many conversations we'll have. And then on behalf of UHW, I want to thank Eric. I know he had dropped off. I want to thank Savonnda. She did an excellent job. And Dr. Little-Richardson and Dr. Dodd, thank you so much. You did a great job. I've learned so much, and I'm ready to roll up my sleeve now and get my shot. So I really appreciate it. So I just want to say to you, the audience, a couple things. Wear your mask, wash your hands, keep your distance, and stay safe. Good night. And thank you.
Good night.
Good night.
Okay.